Hi, I'm Andrew.
And I'm Molly.
And this is IET, and we help youth athletes move better, perform better, and play better.
Hi, I'm Vanessa Lagarde with Hampton's Mouthpiece, and I'm here today at IET, Integrated Exercise Therapy in Bridgehampton, New York. And I'm speaking with Andrew and Molly, and we're going to get started today with some exercise routines.
Go back up into it again, hands up in the air. Yep, and drop that back into that squat again. See that first move, how her knees go in? Very first thing she does, and she's not even into like a quarter squat. So for someone who wants to perform at the kind of level she's performing at, state championship, field hockey, and track, to have that little stability in her core would be a concern. That would be something that's going to lead to injuries. So this should be relatively easy for her to keep these legs up in the air. This is a testing of her deep core stabilizers. Take a big deep breath in, hold your breath. Hold your breath, hold your breath. Now keep that breath held and match my resistance. Keep that breath held, match my resistance. Okay, so she can actually hold them no problem here. Now exhale. Take a nice breath in, draw the belly button down to your spine, and exhale, match my resistance. Right. So that's the difference between when she holds her breath and doesn't hold her breath. It's completely different. You felt the difference, right? So when she doesn't hold her breath, her deep core stabilizers don't function correctly, okay? So part of maybe what's going on here is that when she's playing sports, she's holding her breath a little bit, which creates a pattern in her brain that she basically uses that as a compensation pattern and holds her breath. But that then creates a whole chain of dysfunction down into her core. The deep core subsection is not working together. So breathing is the most basic thing we do on earth. We breathe about 15 to 20,000 times a day. If we do that incorrectly, that's going to cause a whole host of problems in your body. We're going to grab a little weight, and we're simply just going to give her a simple feedback drill where she breathes with a weight on her stomach, and that teaches her how to breathe down through her diaphragm into her belly and expand her rib cage a little bit. So take a nice breath in. So now I don't want you to breathe up through here at all. I want you to try and breathe by right down through here. Take a big breath in. And as you breath in, you should raise that plate through here. Big breath in. And again. One more. Good, so now we're going to go back and retest. The idea of the breath is basically to get her breathing down using her core correctly again, and that should reset some of the patterns, so when we test this now, we should have a little bit more stability. Take a breath in, draw the belly button to the spine, exhale, match my resistance. Match my resistance here, match my resistance, match my resistance. Good, and again, breath in, belly button to spine, match my resistance, exhale, exhale. Good. Feel the difference?
Yeah.
Right? How all of a sudden now, so now just by doing that breathing work, she's actually able to maintain and hold her legs up, whereas before they just flop straight down. So the next step from here would be have her do some rolling. Watch how quiet her lower body is, right? Watch how her lower body doesn't do anything. See the separation upper and lower body? Good?
Yeah.
Right? Your turn. This is something that we find we ask people to do, and they look at it and go, oh, this is kind of easy. And then they get on the floor and realize, not so easy. Right hand up in the air. Yep, head comes straight up in the air. Good, look to the floor, reach the hand out, exhale and go. Perfect. Good, excellent. There are 8 different patterns here. Almost always we will find at least one of those patterns not working correctly. So now left arm still straight, up towards the window basically. So this one's going to be this way.
This one, right?
Yeah, there. Yeah, look at that right hand. Look at that hand. Good. And then reach the hand up and find me with your eyes. Yep. Keep going. Find me with your eyes. Find me with your eyes. Find me with your eyes. Good.
So.
Yep. Little movement in that leg. So the idea of these exercises is to use your core correctly. If we have people who come in who overuse their neck and their shoulders and their quads and their calves, they're so used to using those muscles and their body's not able to go to the core. When we bring you down to the floor, basically the resistance is totally changed. You can't muscle this. You can't use your quads. It just won't work. So it forces you to use your deep core stabilizers, and it's almost like hitting a reset button. that we get people to do this back and forth 3 or 4 times, and all of a sudden we get back up and everything starts to look a whole lot better because their brain has basically hit a reset button and figured out how to stabilize correctly using our core stabilizers, using our deep core in through here rather than using the extremities, the legs, the quads, the neck, the shoulders. Come on up. So now we'd ask, after doing that, we just put it right back into a squat and see if that squat looks any better. So face me, feet a little wider. There we go, hands above your head. Nice big breath in. And sit back into that squat. Okay, not bad. So again, I still think that ankle mobility is going to have something to do with what's going on there because she loses balance, but she actually went significantly lower in that right there. So what I would do is just find a little mat right here we can use. So just throw your heels onto that mat. So just the backs of your heels on that mat. Yep, there we go. Hands up in the air again. Okay, sit back into that squat. Good. So we're significantly better by just giving her a little ankle lift right here. All of a sudden, we're not going as close together with those knees. We're going much, much lower. Upper body's quite good. Everything's good in nice in line. Their thoracic extension looks good. Come on back up. But so we would definitely be looking at giving her some ankle mobility drills to make sure that the ankle restriction she has in that right ankle isn't causing some of the problems here. What we do from here, we go into some glute work because we still think there's something going on with the glutes also. We're going to put this, step into this for me. Yep, and here. We're going to bring this right up to the knees right there. Okay, feet shoulder width apart. Yep, hands up in the air. And now keep these knees out nice and wide. So almost like bring the knees out to there. Not the feet, the knees. Yeah, there you go. That's it. Now squat like that. Keeping those knees wide as you can. Keep those knees wide as you can, wide as you can. That's it. Good. And back up. So I want you to imagine these are pulling, this band's pulling you in. I want you to imagine you got to keep those knees as wide as you can. And go. Yeah, that's it. Nice and wide, nice and wide, nice and wide, nice and wide. Keep them wide, keep them wide, keep them wide. Now go lower. Now go lower. Good? Okay. So as you can see, the magic green band just had her squatting about 6 inches lower. Come on, back up. So if we were to go back and look at the original squat versus that one, it's night and day. And that will tell us that she's got some issues with how her glutes fire. And so if her glutes are not stabilizing her hips correctly, then she's falling into that valgus. As soon as we created, this is called RNT, reactive neuromuscular training, where we basically feed the mistake. Her body's mistake was to cave in her knees, so we put a band around her knees to actually make that happen even more. And I told her, don't let that happen. And her brain then was forced to kick in and switch back on her glutes, and all of a sudden she dropped 6 inches lower. And that's, a simple way to put something like this in a training program, and all of a sudden the correct muscles are now working, and we're going to get much more benefit, and her brain's going to learn how to function using her glutes when she's moving like this.